1/3 of women go through a traumatic experience while giving birth that can lead to issues such as depression and post-traumatic stress disorder. This is an experience for women all around the world because it can lead to many mothers to not want assistance because a lot of the horrible experience that they have gone through is because of the staff at hospitals. This leads to an increase in mothers who would rather stay at home, and some may not be able to get assistance because of socioeconomic factors, which can lead to maternal mortality. Mortality rates have been declining worldwide, but they have been increasing in the United States.
The United States is ranked 5th in the world for rates of maternal mortality. Over 98% of births that occur in the United States are in a hospital. Studies have shown that the preventable deaths have a high percentage of 63.2%. Hemorrhage is the leading cause of death, and this is because there was a lack of staff, resources, and blood supply at these hospitals, and each hospital in the United States is different when it comes to what resources they have. A survey conducted in Laredo, Peru showed that women were often not able to afford medical insurance and the cost of having a baby in a healthcare facility. Some women also did not have any transportation, so they chose to have a baby at home. Issues like these are also seen in the United States. Socioeconomic factors, healthcare, and access to resources are the 3 biggest factors in why mothers may not be able to give birth in a hospital or healthcare facility or maintain maternal health during the pregnancy. Besides those 3 factors, many women also feel traumatized to go back to a healthcare facility. In a global survey of 66.7% of women claimed that healthcare providers would often prioritize their own agendas over the woman and baby's needs. In addition, many women felt that their embodied knowledge was being ignored, and they felt as if they were being lied to during the labor process and threatened. This can also be seen with midwives and doulas, which occur at home births. It is not uncommon for healthcare providers to not listen to a patient. This has caused many women to be hesitant to ever go back to a healthcare setting to give birth. In addition, there is a racial disparity when it comes to maternal mortality and race. Ways to help decrease this ongoing issue is to educate the public about poor maternal health, resources, and contraception. It is also important to encourage small things such as donating blood and supplies to hospitals, since hemorrhage is the #1 cause of preventable death. Funding could also help with getting more resources to hospitals, and it could help with those who may not be able to afford giving birth in a hospital. There have also been many campaigns.
Some of these campaigns include Raising Our Voices for Maternal Health by momsrising.org, Every Mother Counts by Calvin Klein, and Black Maternal Health Week. These are just 3 of some of the bigger campaigns used to raise awareness for childbirth mortality.